He walked into the ER laughing. 2 hours later, he was herniating. Saturday afternoon, 17-year-old male, skateboarding accident, hit his head, no loss of consciousness, walks into the ER with his friends, laughing, joking. I'm fine, just a bump. Initial vitals are perfect. BP 120/70, heart rate 75, GCS 15, fully alert. Oriented to person, place, and time. His friends want to leave, go back to skating. He wants to leave too. But something makes me pause. The mechanism. He fell backward, landed on the left side of his head. Hard impact, no helmet. I do a neuro exam. Pupils equal and reactive, moves all extremities. Strength 5 out of 5 throughout. Sensation intact. No obvious deficits. He looks fine. Completely fine. But the mechanism bothers me. I order a CT head, just to be safe. He rolls his eyes. This is such a waste of time. The CT takes 10 minutes. I'm reviewing other patients. Expecting a normal scan. Then the radiologist calls. You need to see this, now. I pull up the images. Left temporal bone fracture. And underneath it, a lens-shaped hyperdensity. Biconvex. Pushing on the brain. Epidural hematoma. Arterial bleed. Middle meningeal artery torn by the fracture. I go back to his room. He's still joking with his friends. Still looks completely normal. How do you feel? I ask. Fine, told you. Can I go? Not yet, I say. Your CT shows bleeding in your head. We need to watch you closely. His smile fades. Bleeding, but I feel fine. That's the problem with epidural hematomas. There's a lucid interval. A window of time where the patient looks and feels completely normal. Minutes to hours. But the bleed is accumulating. Slowly at first, then faster. And when it decompensates, it happens fast. We admit him to the ICU. Neuro checks every 15 minutes. Neurosurgery is notified. They're watching, waiting, seeing if the bleed stabilizes or expands. 30 minutes later, the nurse calls me. He's acting different. I run to his room. He's confused. Doesn't know where he is. Where am I? What happened? His left pupil is larger than his right, sluggish to react. This is it. The lucid interval is over. The hematoma is expanding, increased intracranial pressure. Uncall herniation starting. We call neurosurgery. He's herniating. We need to go now. They're already scrubbing. He's in the OR in 20 minutes. Emergency craniotomy. Burr holes first to relieve pressure, then they evacuate the hematoma, ligate the bleeding vessel, decompress the brain. The surgery takes 3 hours. When they're done, the hematoma is out. The pressure is relieved, his brain has room to breathe. He wakes up in the ICU the next day, groggy but responsive, moves all extremities, pupils equal again. 2 weeks later, he's in rehab. Walking, talking, cognitive function intact. He makes a full recovery. His mother tells me later, if you hadn't done that CT, if we'd just gone home, he would have died in his sleep that night. She's right. So what are the teaching points? Point 1. The lucid interval is real, and it's dangerous. Patients with epidural hematomas can look completely normal for minutes to hours, then suddenly deteriorate. This is a classic talk and die scenario. Point 2. Mechanism matters more than presentation. High-impact head trauma, especially temporal region, can fracture the skull and tear the middle meningeal artery. Even if the patient looks fine, image them. Point 3. Epidural hematoma has a classic CT appearance. Lens-shaped, biconvex, doesn't cross suture lines. Arterial bleed means rapid accumulation. This is a neurosurgical emergency. Point 4. Watch for signs of herniation. Declining GCS, blown pupil, contralateral weakness. Cushing's triad, hypertension, bradycardia, irregular respirations. These mean the brain is being compressed. Time to operate. Point 5. Not everyone with head trauma needs imaging, but high-risk mechanisms do. Fall from height, high-speed impact, focal neurologic deficits, loss of consciousness, vomiting, severe headache, and coagulation. These warrant CT, the bottom line. Don't trust the lucid interval. A normal-appearing patient with significant head trauma can be hours away from death. Image when indicated, admit when there's bleeding, watch closely, and get neurosurgery involved early. The patients who look fine are sometimes the ones in the most danger. Want more cases? Link in description.